Okay, well, thank you so much. I'm really excited to talk about this topic. I think we've been digging deep into a number of topics, and I thank you, PMD Alliance, for hosting and being generous with just, kind of going with the flow of wherever we go and, what we need to be talking about next, and trusting me to find, speakers that are on point and really, kind of breaking into new horizons. So hopefully we can, sort of really deepen our conversations. This month, the past month was Parkinson Awareness Month, and I think we've been, looking at all the populations that haven't been served well with Parkinson's and trying to understand, how to do this better, do this work better, to understand, the patient voice, not just for the I think I said this so many times in the last couple of months, but the affluent white males that are married, that are usually older, are usually the sort of populations that are represented in our research, in our focus in terms of treatments. And I really think that we need to kind of break that mold. So we've had some amazing talks, and I think Rochelle Flanagan, who I see here in the chat, has joined us, has really done a great job of starting this dialogue, and had a couple of panels, and we wanted to sort of dig deeper with some of the hormones and to understand it from, a really amazingly unique perspective of Dr. Oosterbaan, who joins us from Nijmegen in the Netherlands, and she is a person, a woman, a mom living with Parkinson's, and she's also an OBGYN, who has that background and brings all this knowledge of hormones. And so I had the pleasure to speak with her a little bit about her experience, her symptoms, and to understand what she thought needed to be focused on a little bit more. And she agreed to teach us a little bit about the hormones and sort of do a review of a little bit of the background, because I think it's important to understand, for women, the different sorts of time frames in which, these different levels of estrogen and things are coming in and out, and how that might interplay with Parkinson's. And I think not just for women with Parkinson's, I think if we can understand how the women's experiences with their hormones, with these sort of modifiable variables, we can hopefully help all patients with Parkinson's. So I think I'm excited to introduce Annelien. Thanks so much, Annelien, for joining us. And maybe tell us a little bit about your story and kind of what led you to sort of where you are right now.
Yes, I will. Thank you for inviting me in the first place. I'm really happy to be here. Indeed, it's special for me being a patient and a gynecologist, and it made me dive into this topic. And that's why we got connected. I have made a presentation, and I want to share my screen, and then I'll tell you more about this topic.
Great. Thanks so much. Okay, go ahead and share your screen, and we'll look forward to hearing from you.
Good. Wait. Start at the beginning. I'm so sorry.
You're fine.
All right. You see my presentation?
Perfect.
All right. Well, I'm talking today about the women and Parkinson's disease, about hormones especially. Myself, I was diagnosed with Parkinson's disease 5 years ago, at the age of 33. I'm 38 right now, so this is my first decade of Parkinson's, and it was actually quite a first 5 years. And I'm quite happy with my situation right now. It hasn't really progressed that much, but still it's challenging to live with Parkinson's. I'm a mother of 3 young kids. They're 5, 8, and 9 years old. And it actually felt when I got this diagnosis that I was forced into an old man's suit. As you said, it's mostly white old men who suffer from Parkinson's. At least that is the perception, but it's not the reality. And I think it's time to change this perception and raise awareness. That is also among young people, and it's also among young women. Living with Parkinson's disease is challenging, but it also enriched my life in a way. I set my goals, I live life to the fullest, and that's different. I'm more aware of things. I decided to combine the knowledge of being a gynecologist with my personal experience as a patient, so I can be a true ambassador for women with Parkinson's disease. And of course, the goal is to achieve a better quality of life for women with Parkinson's disease. There are gender differences in Parkinson's. Parkinson's in general affects approximately 10 million men and women worldwide, and the incidence is 1.5 to 2 times higher in men. Women also may have a later age of onset, or do they get their diagnosis later? That's the question. Here you see this chart in the United States. You see the upper line there, the male patients, and the below line is the female one. And you see over the age, the incidence of Parkinson's, with a peak around 75 to 84. But it starts at 30. But you also have younger patients, of course, sadly enough. Women have a lower risk of developing Parkinson's disease. There are also differences in the way that men and women experience Parkinson's. Women are highly underrepresented in research. Studies do indicate that women report different symptoms and they experience more side effects and fluctuations in symptoms throughout the day. But in here you see this image, I think you've all seen this before, about the differences in symptoms in men and women. But still, research up to date is not conclusive on these differences. There's a really big knowledge gap here. Explanations for gender differences may be men and women are genetically different. There are more described more LARC2 mutations in women, more often a positive family history. And men may have more exposure to reported risk factors like smoking or coffee intake, physical activity that are decreasing the risk, and increased risk are head trauma, pesticide exposure, and dairy consumption. So maybe because of their jobs or other hobbies or things they do, they have more increased risk. Also, women have been reported to have a lack of access to healthcare. Maybe it's due to themselves as well, because we care for others and not for ourselves that much. There are also unintended differences in the way women are treated compared to men. There are no trials for women. Medication source and dosage are based on men studies. So that really needs to change. Also, men and women are biologically different. Of course, in a hormonal perspective, we have the estrogen, and men have the testosterone, and you see the woman standing there with the estrogen peak and then dropping in menopause. And it has been described that estrogen may protect the brain against PD. But how does this work? Hormonal fluctuations. Damn, I feel like a woman. I can feel like that. But then also a woman with PD, that's even worse. Help, what to do about this, because we have our symptoms from Parkinson's disease, and also we have to suffer from the menstruation and the effects of Parkinson's on our of the menstruation on our Parkinson's symptoms as well. Thanks to the PD Avenger survey, they have shown recently the hormonal impact on Parkinson's, and women have reported worsening of the symptoms around the menstrual period. So even that the studies in literature are not conclusive on this topic, this survey does really show that more than 70% of women report worsening of the PD symptoms around the menstrual period. And it's mostly reported to the week before the period, and or in the week of the bleeding, and then later. That's actually the most, according to PMS. Also, they have asked about the menopause and whether it showed that it was difficult to have symptom control during perimenopause. Symptoms fluctuate randomly during perimenopause, so that's difficult because it's random. Postmenopause symptoms were about the same, and only 20% used HRT of these women. And the effect of HRT on PD symptoms was in more than 45% effective, so the symptoms were improving, and about 30% the same or worse. So that's not really that supporting yet. The most striking, I thought, was the neurologist engagement, that whether they asked or knew about the impact of hormones on PD symptoms, it was only in not even 20%, 12% maybe. And whether they knew about the effects of menopause on PD was only less than 10%. So that was really striking to me. So this topic really needs attention. Then how about the menstrual cycle? What is it with the menstrual cycle and the hormones? I take you to the hormones during the reproductive phase. You see the above line, that's the most clear pink line, that's the estrogen levels. You see the estrogen, this is the days of the cycle. If the cycle is 28 days in total, you see in the middle of the cycle your ovulation. And then you see after the ovulation, the progesterone peak, and they think the severity of the symptoms and the worsening in the last week is due to the estrogen drop. So you see the estrogen is rising, and at the end it's dropping again. So mostly the symptoms are less in the middle of the month. Maybe that's due because the estrogen is at the highest level in the middle of the month. But I would not want to underestimate the effect of progesterone. So that's really something we don't know anything about. So that's something for further study. The effects of the menstrual cycle on PD symptoms. These are the motor symptoms. They have been reported to get worse. Mostly bradykinesia, rigidity, tremor, low voice, dyskinesia, and dystonia. But also non-motor symptoms got worse. You see many of the non-motor symptoms, and also reported anxiety and depression. As you can see, 46%, 59%. But it can also be due to PMS, because those are symptoms that have overlap with PMS. Is it indeed the estrogen drop? That's the question. I'm not sure about this, but it can be. Then how about the perimenopause? Hormones and the perimenopause. This is a chart, and you can see the hormones during the whole life cycle. Here, this is from 35, and this is to 75 years old. And the above line is again the estrogen, the slow drop in estrogen over the course of life. You can see that, and it's the same for the progesterone. But as I told you before, there's not much known about the effects of progesterone. How about our egg stock then? When we are born, we have like 700,000 follicles, and we only use 400 to 500 of them. That's the amount approximately that ripen in our whole menarche period. And when we reach menopause, we only have approximately 1,000 follicles left. So that's a really big decrease. You can see. Menopause starts mostly between 45 and 55 years old. The last menstruation is mostly around 51 to 52 years old. Only 2% visits their GP because of symptoms of menopause. and 80% of women suffer from symptoms. And 1/3 of these women suffer from serious symptoms. So you can see how little women go to their doctor while they do have symptoms. So we don't take that good care of ourselves, actually. We should take better care of ourselves. And the symptoms that are most reported are hot flushes, sleeping difficulties, depression, anxiety, muscle and bone pain. And I see a lot of overlap with Parkinson's symptoms there. So that can be also difficult if you already have some depression or anxiety or sleeping difficulties with your Parkinson's and you get this menopause on top of it, it will not be nice. And it will be difficult to say what's what. So should we take hormone replacement therapy and say goodbye to the symptoms? We could. About the dosing of HRT, you should take as low as possibly effective. And women with a womb should take a combination prepared with also progesterone. Without a womb can take estrogen only. And you can also take a transdermal, like a plaster or a gel. And you don't have the first pass effect through the liver. People are always afraid of the risk of breast cancer. But if you see there are 23 cases of breast cancer diagnosed in the general population, then when you give them HRT, you see only a few women extra. So, and there are even 4 fewer cases in women that use estrogen HRT. So I shouldn't worry that much about the increased risk on breast cancer. There are many other things that increase your risk on breast cancer. So if it makes your life better, I wouldn't really hesitate as much unless you have a predisposed risk on breast cancer. Estrogen in the brain. As I said before, there's a potential protective effect of estrogen on the brain or on brain disease. It has also been described that lifetime estrogen exposure and cognition in late life, like the prevalence in Alzheimer's disease, is higher in women. And that, what did I want to say? If you have a longer exposure to estrogen or you use HRT, you have a better cognitive state in later life, so it can be protective for the brain. But that's all some things that needs to be studied more thoroughly. And what I believe is that we should do much more future research on. We should do more surveys on the women among women, asking them in more detail about their menstrual cycle, their symptoms, whether they use oral contraceptive pill or whether they have a hormonal device or just have their regular cycle, and see how their symptoms change over the cycle. Maybe we should track their cycle for like 3 months in a row and see what happens. We should do reviews on the current literature and see what we know and what the knowledge gaps, just define the knowledge gaps we need to dive into. And I think it's time we need to put women in trials, medication and intervention trials to see what could be possible effects of maybe hormone replacement therapy on Parkinson's symptoms in women with Parkinson's in the menopause, whether that has any effect also women suffering from hormonal difficulties or influences on their Parkinson's while they are in their before their menopause, whether we can improve their quality of life by maybe giving them a contraceptive pill continuously or giving them a hormonal intrauterine device, or see what the effect of hormones can be if we make them more steady. I'm sorry, I'm really a little bit off right now. You can notice, right?
No, you're awesome. I mean, it's hard to I would be intimidated to give a talk in a language that's totally different. For me at baseline, I can't imagine. You're awesome. That was great, Annelien. Thank you so much for that great talk and putting all this information together. And joining us at a different time zone and balancing all the work and life and babies and I mean
Yes.
kids, all this stuff, it's hard. So I think we have some questions. Are you still, do you still have some slides, or are we done with that?
No, this was it actually.
Okay, perfect. Let's stop sharing then so we can see your
Yes.
beautiful face in pink, pretty in pink there. So thank you again. I mean, I think it's really hard to try to figure out even where to start when we're talking about these conversations. And I think there's so many unmet needs and so much information that is not out there. I mean, every time I've tried to do a brief search, I think, there's just like multiple questions and so much, to tackle. But I think you've, I really thank you for trying to, sort of remind me of, when estrogen is peaking and progesterone and things like that. I think it's very helpful to see that visually and to understand sort of where, things are, hormonally happening in these different of life, because it is complex. First of all, I think it's a pretty amazing group here that we have joining us from all over the world. Literally, I've seen people from Canada, from all over the United States, but also Ireland, and the UK. It looks like somebody, Ungodly Hours in Sydney, some folks
Oh,
in
wow.
New Zealand. So I'm just so excited to see the global kind of group that's really forming. And, I think even though people have said, women are less affected, and then even women that are younger, that are dealing with some of these hormones are even a smaller population, I still think that it's amazing to see the sort of sisterhood that seems to be developing across the world, to sort of help I understand this a little bit. So I really applaud that, first of all. We'll try to spread this video so people can also talk about it. I think between the two panels and Rochelle's survey, and then this information too, I think we can kind of maybe put together a paper of unmet needs to sort of just start from a platform of what we know, what we don't know, and what we sort of need to kind of understand a little bit more. So thank you so much for that information. One of the questions, I'm just going to sort of look in the chat here, is a postmenopausal woman. Is that the same as a man in terms of their hormones? And then is the risk after becoming postmenopausal, does it become similar in getting Parkinson's in postmenopausal women as compared to men in those sort of later age groups? I don't know if you know that exact details, but maybe you could, first of all, the question is about hormonally, are they the same as men once they've entered menopause?
No, hormonally, we're never the same as men. Thank God, no. No, it's still the same, but our estrogen is just much lower than before menopause. So, but we still don't have testosterone, and we still don't, we do, but not that much. And we just have lower estrogen levels and not the cyclic fluctuations over the month anymore. The incidence of Parkinson's, I think it's still the same as among younger groups, that there's still more men than women getting Parkinson's.
Yeah. And I think it's varied a little bit in Asia too. I don't know if you've seen the data. I think in some Asian countries, I know Rochelle was saying this too, that it seems like it's a little bit high. It's sort of more even with women and men in some of these.
Yes.
And I don't know if you have any theories as to why that might be.
No, I'm not sure, but you have to think on environmental factors or dietary
Yeah.
patterns, the things they do or how they live over there. That's different compared to us, but it's just really interesting to look into that.
Absolutely. There's a question about bioidentical versus synthetic hormone replacement therapy. Do you know, is it different depending on the bioidentical hormones versus synthetic hormones? There's a lot of talk around, trying to get bioidentical hormones versus synthetic. I don't know if in the Netherlands that people are also looking to do that.
You mean the more natural hormones?
Yeah,
Yes,
I think so. I think they're
it's
sort
more
of,
popular because people don't like to take the synthetic hormones. It's just, I think you should just try what works for you and what's better for you. But many people also have benefit on the synthetic ones.
There's a question here
You
about,
should try. You should just try what works for you and what you feel comfortable with.
yeah, absolutely. And it's definitely working with, I think it sounds like women don't approach their gynecologists or their doctors a lot with their symptoms, and the Parkinson's neurologists are not probably inquiring about this. I think starting a dialogue at least about what people are going into, with some of the perimenopause and then going into menopause. I think it would be helpful to sort of see what our women are experiencing, but it sounds, I agree. I think there's such an overlap between what you listed there and the perimenopausal and menopausal sort of symptoms that many women suffer from and never get, it sounds like, any help with. And then the
Yes,
Parkinson symptom complex as
I
well.
think that's also a reason why women don't report their symptoms, because they think I already have Parkinson's, so it is my Parkinson's, but maybe this is extra severe because of their hormones. And if they use hormone replacement therapy, they can have a much better quality of life. So I think it should be something that should be discussed by the neurologist during these periods of life. It's just an essential question.
So when would you, if you're a woman, let's say in your about 45 and you have Parkinson's, when would you start to sort of discussing? So it sounds like sort of when the peak starts to happen of when people go through menopause is, you said 48 to 52 or something like that. And so would it make sense to start thinking and maybe tracking symptoms in that sort of mid 40s timeframe to sort of see if there may be something that's changing, and then consider, like you said, the birth control pill or some way to keep the estrogen levels a little bit more stable as they're going into menopause? Well, what's the sort of,
Well,
what do you sort of recommend?
I think even when you're younger than 45 or 48, you should be discussing this with your neurologist, because you can also have cyclic patterns in your symptoms. So I think it should just be a standard question every visit. And as soon as you notice cyclic pattern in your symptoms, you should try to get that improved. And then when you get into perimenopause, you will notice, because your cycle will become shorter or irregular, or you have more irregular blood loss or more blood loss. So you will notice the time you get into perimenopause. And I think it's up to the neurologist as well to ask for these symptoms, but also for the women, when there is awareness and they know that this can happen and that this can influence their Parkinson's as well, they should discuss this. They should feel open to discuss this with their neurologist too. So the awareness is two ways, and the topic should be discussed by both of them, and there should not be any shame or things like that.
Absolutely. I think, I'll just own it. I think, when we went into neurology, I think there was very little discussion about any of these sorts of things. And even in arenas where, like, multiple sclerosis, which affects a lot of younger women, and hormonal changes, I don't feel like I really got trained very much in any of these hormone things. And I sort of, it's giving me reminders of medical school now to see those graphs and stuff like
Yes,
that. But I mean, this is like, 50% or more of the population in many of the world. And we just sort of tend to just forget these whole areas because we're so focused on other areas. And I think it's not because we don't care, it's because we just, probably some part of it is time, and some part of it is sort of just tackling the things that patients tell us about, which
yes,
may not be on their radar. It might be good to work on a tool maybe of maybe some way to track symptoms through a diary, maybe a motor diary,
yes.
a non-motor diary.
I've been
Then
working on a cyclic diary to
yes,
track as well hormonal symptoms as more Parkinson's symptoms, and to do research with that, and to
that
have it as a tool
sounds
for all people visiting their neurologist so they can fill it up.
That sounds amazing. Yeah, happy to help you with that. And I think a lot of the other folks it's resonating with as well. And then, also those sort of overlap symptoms. So sort of maybe a checklist of things to sort of say, these are the things that I've newly experienced in this
Hmm.
time frame as, I'm going into the perimenopausal and menopausal sort of arena. And they may overlap a lot with non-motor issues. And I think one of the problems is that I think women don't complain sometimes, and we are sort of a little bit more stoic. And then one of my worries about sort of the interface between neurology and sometimes even the mental health world and women is that, so many of my discussions of younger onset Parkinson's patients is that their diagnosis was really delayed because there was a sense that their symptoms weren't really real for a long time. And some of them were actually told that it was all in their head. So sometimes I think there's a sense that, is it real? Is it something that I should complain about? Is it somebody's not going to take me seriously? There's, I think, so many barriers to even coming forth. And so I think if it could be standardized in a questionnaire and then, checklist, we can just present it, to the doctor, and it becomes a little bit more of a tool rather than, sort of having to get out the words and explain and then be taken seriously.
Yes.
I don't know if you
Even-
experienced that or
Even my movement disorder specialist was looking with questions in her eyes and just thinking, I don't know. She hadn't heard of these hormonal different influences on my Parkinson's, but I said it is really true. And I told her about the PD Avenger survey and about all these neurologists not asking about this. And she was a little bit ashamed, and she said, okay, all next women, young women and women that are still menstruating or in the perimenopause, I will ask about these symptoms. So
Yeah.
she was going to change her outpatient clinic and change her questions.
I love that.
That's good.
Absolutely great. That's amazing.
Should
That's
be a general change.
Yes, I think we need to change in many ways. There's a question about, is there a way easily to measure estrogen and progesterone levels in the body, or do you have to take actually blood samples? I mean, how do we sort of have a sense of that? Is there, I guess you can track temperature sometimes as well, may fluctuate with these cycles as well. I don't know if there's an easy way to track some of these things sort of in a secondary way with temperature checks or other things.
Well, just while you still have a regular cycle, you can see where you are in your cycle, because the first half your body temperature will be a little bit lower than the second half of your cycle. But I wouldn't know why you want to do that, only if you want to become pregnant, because you can time your ovulation with that. Otherwise, if you're interested in your estrogen hormonal levels, it will only be, I think, if you want to know whether you are in your menopause or postmenopause. And then you can actually only see it by taking blood samples. But as you can say you've had your menopause when you haven't had menstruation for 1 year. So then you are past it.
Okay.
So most of the times it's not necessary to take blood samples.
Okay.
But if you haven't menstruated for a year, then you have gone through it.
So it looks like there's a few other OBGYNs out there with young onset Parkinson's. So I think we can try to connect the group a little bit more. I don't know, Nicola's saying, how many female movement disorder specialists are there? Also, as a retired OBGYN with young onset Parkinson's, I know 2 OBGYNs with Parkinson's. So it sounds like a group that could be starting to connect. And maybe Nicola, if you want to email Andrea, we can start connecting some folks who might be interested in this area. What people are asking about testosterone, progesterone. Wow, I can't even keep up with the messages. There's like 25 messages. I'm just like overwhelmed here, but I will try to get to all of them. But I think we have like an outpouring of interest here. So, a question about progesterone. So what's your take on progesterone? Do you think it's also protective in some way and replacing progesterone? What's your sense of that?
I don't think it's protective, but I think it can also be of influence in the cyclic pattern and the influence on your symptoms, the fluctuations. So I wouldn't underestimate progesterone in this field, but there's not that much known on the role of progesterone, but that's also a hormone that's fluctuating over a cycle. So we're always talking about estrogen, but we also have progesterone that we should look into, I think.
There's also been a few questions about vaginal estrogen creams and stuff like that. Do you have, does that actually get into the blood system in a good way, or is it just a local thing? And would that have any influence on Parkinson's symptoms if you use the vaginal cream?
Oh, I wouldn't know if it would have influence on the Parkinson symptoms because we haven't even got it clear yet whether it helps us, but it does get in your system a little bit when you use it vaginally, but it's mostly used to get a more less dry vagina because that's what you can suffer from after menopause.
Yeah. There's also some questions here about bone density and hormone replacement therapy and how that might impact the idea of going on hormone replacement therapy if you're a woman who's postmenopausal with Parkinson's. Do you have a comment on that? Does it help bones to go on hormone replacement therapy and fall risk and stuff?
It does help for that in general, but I don't see the benefit in Parkinson's in particular. But in general, of course, hormone replacement will help, and in your bone, because your bone density will decrease because of the decrease in estrogen levels. But you can check that with the DEXA scan or ask your physician on that whether you need it or not. But of course, it has influence, and maybe in Parkinson's, if you have a higher risk of falling or breaking bones, you should even be more aware of this.
Absolutely. Maybe we can locate Rochelle. She has a question. Maybe she can ask it live because it's a bit complicated. So Andrea, I'll leave that to you. And I know she's had some other messages here. So I'd love to have Rochelle found and ask these questions directly.
Hi guys, can you hear me?
Hey, Rochelle.
How are you? That's a fantastic presentation, Annelien. I suppose I don't know which one. I've asked several questions, but I think I suppose the one was about the type of HRT. Can you still hear me?
Yep.
Yes.
Yeah. So I was speaking to a GP with a kind of interest in HRT, and she was saying that there might be a risk of, I think is it womb cancer or bladder cancer? I can't remember which she said. If you take HRT, just the estrogen, that you should take progesterone with it. I think that's what she said to me.
Mm-hmm.
Is that the case, that there is a risk?
Yes, because if you only take estrogen and you still have a womb, you can still make how do you say that, endometrium. That's the thing you lose when you get menstruation.
Yep.
And if you don't use progesterone with it to keep that, make sure you don't make endometrium, you can make these cells can become, how do you say it in English?
Like procancerous.
Yes.
Yeah.
So that can be a risk. So that's true.
Yeah. So it
Is
sounds
a
like
high risk,
you should take a combination preparate.
Okay. And just in terms of some of the research I looked into in terms of taking estrogen, some of the research seemed to indicate that if you take estradiol, that it might slow progression if you take it during perimenopause. But obviously that's on its own, that's not with progesterone. So I presume there's still a lot we need to really investigate about. Obviously, just as a woman, the benefit of taking HRT seems to be convincing, but then B is overlaying that on our Parkinson's, the timing of it seems to be something that we don't really know yet. Would that be correct?
That's true. There's really a lot we need to find out about the timing, duration, what's the best period to take it, and when it would be protective or helpful. Yes, that's true. So there's a lot we need to study.
Well, thanks a million. It's been fantastic hearing you.
I think if we get locate Audrey too, I know she wants to say something to be live. I don't know if we could do that. But in the meantime, let's I wanted to ask, one of the questions that had come up was about in the week before menstruation, so like that premenstrual syndrome kind of week, people had talked about, taking extra levodopa tablets and whether that was a reasonable idea. I wanted to get from the group here, and, Annelien, also your ideas. Is there things that you do in that week? It sounds like most women have worse symptoms in that week, at least from Rochelle's survey. Just sort of on a practical level, are there things like, do you try to sleep in a little bit? Do you do extra, maybe yoga or meditation or anything, warm baths? Like, what are you guys doing in that week to kind of get through that week? Are you taking extra medications? Maybe people could, give us a sense of that if you want to type it in the chat, or Audrey, I think you had something to say as well. Do you want to say it?
Yeah, it's not. Hi there. I'm postmenopausal. Can you hear me okay?
Yes.
Yeah, excellent. And I've been sort of digging around trying to find out whether I should supplement now, having not had any HRTs for about 10 years post-menopause. And I've been told that testosterone, as well as a very light, low-dose HRT, might be acceptable, and the testosterone would be good for the brain, because women actually produce 3 times more testosterone than they do estrogen, which I thought was quite interesting, and it has a big role to play in bones.
Annelien,
so I wondered what your view was on that.
Thank you, Audrey, for your question. It's a good question, but I haven't really dived into the testosterone effects on the brain. I'm not sure whether that would be protective, actually. But that's an interesting question.
Thank you.
Sorry, I don't know.
Nicola's been, she's the other OBGYN, I guess, on the chat. If we could find her, maybe she'd want to say something live. But I think that there's been a lot of sense that we just know very little about a lot of things. So Gina says here that she clears her calendar to have flexibility to accommodate herself. And I think, as women,
I suffer from these symptoms worsening too, and it doesn't really help me taking more levodopa. I sometimes do, just maybe for the idea, but it doesn't really work. So I just try to plan different things, and sometimes do more yoga, try to relax, and try to think it's only a couple of days and it will go away again. But also my boyfriend, he knows, he says, oh, these are these days again. I can see it on your arm. Your arm is more shaky. He notices even. So it's really there.
yeah. No, I think it's definitely there, and there's a lot of voices.
I think it's therapy resistant, and that's the really annoying thing about it.
Absolutely. Nicola, did you want to say something? I'm not sure if we found Nicola and willing to come up on screen, but a lot of amazing information here on the chat. So any other thoughts? Yes, so I think we have to do, I think, it's such a diverse population, women themselves, right? So the sort of the younger women who are still menstruating, the perimenopausal, the menopause, postmenopausal, so many different types of questions. But I think since it's sort of a population that's more less heard, I think women in general have to kind of get together no matter what stage and sort of figure out, what to do. Nicola's saying she's having problems with her microphone, so we may not directly hear from her, but some great chat questions here, and I think there's a lot of great information. I know, Annelien, that we had talked a little bit about pregnancy, and sort of the safety of pregnancy and sort of the thoughts of women getting pregnant with Parkinson's. Could you tell me a little bit about your thoughts on that? I know you've done a little bit of research, and maybe you could share with us sort of what you learned.
Well, what I've learned is that there are only some case reports on pregnancy and Parkinson's, and that there's also a really big knowledge gap there. So I've written a grant application for the Michael J. Fox Foundation to try to get money to set up a registry, a worldwide registry to collect as much data as possible on all women becoming pregnant with Parkinson's. They all need to get in this registry, because this way, that's the only way we can get enough numbers and enough data to eventually get to a management or a guideline, to a management advice. because now there's just not much to say. 50% gets worse, 50% doesn't. Half of the women doesn't take their medication because they're worried about the baby. But levodopa doesn't seem to do much on the fetus, but still women are of course worried. So we need to really know much more about this as well. And we can only do it with a worldwide registry, I think. So even when I don't get the money, I will set it up. We're working hard on it. I hope that by the end of the year, we will go online.
That's amazing. It's such important work. And I think, as we're seeing, I feel like we're seeing cases in younger and younger people in general, and younger women. These are important topics to be able to give useful information around. And it's not good to go off your medications if you're pregnant, I don't think,
No.
Not safe. But we need guidelines to be able to help people understand this and what the risks and benefits are. So absolutely.
Yes.
Eva wrote here that if it was a male issue, it would have happened years ago. So
Yes.
I mean, I think that, with the pandemic and the ability to globally connect like this, I really, and I think, Elena Moro and a number of other colleagues of mine around the world are really trying to band together to help, spread the news, spread the voice, amplify anything that you guys are doing. I'm happy to help. Certainly, my day job these days is taking care of veterans with Parkinson. So most of my patients are men, but we are even in the VA population seeing young women who are also moms, and also, dealing with a number of things that are, balancing all these things that are quite important. And, I think the mental health aspects, to get back to that, we talked about sometimes the delay in diagnosis, but I think women not only don't complain about things and so don't get attention, but sometimes are really stuck in this caregiver role of so many generations, sometimes taking care of their parents, sometimes taking care of kids, grandkids, that they just don't take the time to spend to even focus on themselves and understand these symptoms a little bit better. And if everyone is isolated and not, sort of reaching out to each other, I think it's very easy to feel like you're the only one who has this. And then is it really something that is the Parkinson's, or so complex to figure out that then you don't actually seek help, and then, you suffer silently. So I think, we have to do a better job of making it some simpler way to bring to attention these symptoms. Lori Mishley and I are also having a survey out, and we'll spread that around as well, around women. We and Annelien, you had helped also, and Rochelle had helped guide the questions, and so that's out there as well. Now we've added a number of questions, so we'll definitely try to spread that survey around. So I think surveying, getting repositories, ways to sort of systematically collect information to help is really so important. Nicola's saying that she's happy to help in any way too. So I think we have a lot of people from all over, that are really, something that is just key to sort of just banding together to get, the information out and ask the right questions. And I think there's a lot of even, healthcare providers in the community of patients here that I think can hopefully help systematically kind of arrange better ways to kind of focus on this. In the sort of regard of the mental health sort of balance of trying to focus on the kids and, your boyfriend and all the other people, Annelien, do you tell us a little bit about that balance in your day-to-day life and how you sort of work to help yourself, sort of self-care? How are you trying to sort of balance it all?
That's quite difficult sometimes because mostly there is no time for me. So I just go on and do the things I need to do. I work 36 hours a week, and even the research is extra. And I mostly am really energetic, but of course I also have my off periods and my off days. This week was a really bad week. I was suffering from a bad cold. At least it was not corona, but you can see I have a big tremor now and a bad voice. But I just need to accept it, and I know the moments that our symptoms are worse, and I just try to not ask too much of myself at these moments. And sometimes you just say, okay, I need rest, and I do some yoga, or just start to breathe in and out, and then just this acceptance is the most, how do you say it, the most important thing, and try to laugh about it sometimes. So just start
So it
to
sounds
enjoy
like you
things.
use mind body.
Yes.
Yeah.
Try
So
to
it sounds
enjoy
like
the
you
things
use a little
that
bit of
are
breathing.
beautiful. Try to enjoy my kids. Just try to see what I do have and not what I don't have. So what I can do and not what I cannot do. And so so I struggle through life, but I don't see it as a struggle because I have so much I'm happy about it. I'm not how do you say that? I don't think Parkinson's is that bad. It's just it's a challenge. It's a challenge, but it's not. I'm not suffering.
Yeah, it sounds like you have such a positive attitude. So it sounds like, just to summarize what you said, because you cut out for a second, the breathing and the yoga, maybe you try to
Mhm.
take time for yourself as what best you can because you're so busy and you have so many other people, but then also the attitude. So you have a positive attitude, trying to stay, look at the sort of things that you have, not the things that you don't have, the things that you can do, not the things that you can't, and really sort of trying to focus on the positive things, I think is
Really
something that you've
important
really
is also
sounds.
exercise. You need to really do a lot of exercise. So I do lots of sports. I play golf. I play field hockey. I do. How do you say it? I run a lot, and I have a boxing bag on my attic, and I hit it a couple of times a week. And I do push-ups and sit-ups every day. Try to keep my strength. And every time my body is capable of doing these things, I'm really happy, and that gives me as well as physical as well as how do you say that, mental stimulation, motivation. How do you say
That's
that?
great.
So
Yeah,
I really
motivation,
believe in
absolutely.
sports.
Yeah, that's great. So I think we have about 5 minutes left, Annelien. So in a practical way, could you inspire the audience here? Because I think you have this world of gathered, fellow women with, Parkinson's throughout the world. Maybe, I think, in medicine, it's sometimes, hard to put things down on paper and really get the community, the medical community, to listen and to, be on board. So what do you think are some practical steps, since you're, you sort of straddle both worlds? You're actually many worlds, because you're actually, in OB/GYN, you're a doctor, you are, knowledgeable, you work, in Nijmegen. I think Bas Blom is your also part of your treatment team, and you work with him a little bit, I think. So
True.
what are some practical things that we can do with the gang here, with the medical community, to really move this needle into a place that it needs to be, it should be, with the caring more and doing something proactive about women and Parkinson's?
Well, I think this is a great start. Last all webinars on women and PD, and to spreading the word throughout the community. That's step one. The next step will be maybe a position paper or something in the journals to get the attention of all people in the medical field, in the field of Parkinson's, so they see this, the importance of this topic too. But I think it's getting out there really right now. I think we should define the knowledge gaps really clearly in this position paper. And then we should just start doing research. I have many, many ideas on trials, all the things we can do. We should just write grant applications, get the money, and work together internationally. I've met so many nice people last couple of weeks and months, really so many people that want to collaborate throughout the world, and we should just really collaborate on the highest level we can, and just that will make how do you say I'm sorry, then we will have the best chance of getting as much information as possible. But I think we're getting there.
Absolutely. Well, that is so inspirational. I mean, I think that you're right. We have to collaborate, number one, because I think, everyone doing their little thing in their little pocket, the silos that are happening historically, I think are starting to really break down. And I think we have, sort of momentum of trying to look at things in a new light and looking at the disparities in general. So I think we have an opportunity, but I think it's going to take strong voices and really an organized and collaborative kind of group to really move it to the next level. And it doesn't help if there's a small survey of 10 people here and 50 people there.
No.
Have to sort of really do something, standardize things very consistently so that we can get into good journals and really see a change in sort of what we are presenting at meetings moving forward, what we're reading about, what we're talking about, we had a colleague come on who was talking about, when drugs are approved for treatment to be used in the world, that she thought, because she's really representing, the African American voice, that there should be very consistent racial numbers that have to be in these trials in order for the drug to get approved. I really feel like women need to be represented at least, equally to what the percentage are that are out there, and the age groups as well. So, so that we really have, at the end of the day, drugs that are studied in all the, different populations and not just one, right? So I think
totally agree.
If we push the FDA to do that sort of thing, then I think it'll hopefully end up making this more on the radar of everyone. So I think, yes, so please reach out. I think if we can, start maybe adding people to whatever the groups are that are out there. I think if we, at the baseline, maybe email Andrea if you're interested, and then we can kind of, help sort of spread these names into, places that you guys can all kind of work together. And I'm very happy to help as well. So thank you so much, Annelien. And I know it's late, you haven't been feeling great, but you did a great job. Thank you. It's really much needed to hear all this information. And thanks everyone for joining across the time zones in the world. Have a great weekend. And I look forward to continuing the dialogue.
Thank you for the invitation again. It was really nice.
Thank you. All right, I'm going to pass it back to you, Andrea.
Thank you, everyone. And we always close out with a goodbye wave. So Annelien, you can scroll through the pictures and see all the smiling faces out here of everyone so appreciated and inspired by you. Silly faces too. Bye now. Thank you, everyone.
Thanks.
Thank you.